Many women stop using Aniball because of this false information. It is commonly shared by people who do not know Aniball and its true purpose. The goal of practicing with Aniball is not stretching the vagina or stretching the perineum. The main goal is to practice relaxing the birth canal using proper breathing and an appropriately chosen birth position. We do not recommend practicing before the end of week 36 because we know that it is necessary to respect the natural physiological processes. There's a right time for everything. The birth canal and the entire lesser pelvis start preparing for childbirth in the last trimester. This happens thanks to gradually released hormones, and the preparation with Aniball goes hand in hand with this process. The birth canal starts changing and slowly turns into a fluffy duvet, which the baby is supposed to pass through smoothly. That's why there is no point in practicing sooner, trying to break records and rushing. Childbirth is a unique experience during which a special hormonal cocktail is released, and it is supported by contractions, which are not present while preparing with Aniball. But the breathing is the same during childbirth and while practicing with Aniball. The pelvic floor relaxes with inhalation, just like the diaphragm. This is a spontaneous process which takes place in our body. When women breathe calmly and deeply into the abdomen, it helps them bring the baby spontaneously into the world by proper breathing, without any controlled, forced pushing. It is important to push only when there is the urge to push, and respond to it by calm breathing, not by holding the breath, sucking in the belly, or tightening the anal sphincters. If you think about it, these reactions are not physiological and can cause major injuries to the mother during childbirth. There's also a risk of oxygen deprivation for the baby. Women often have trouble realizing that they relax when they inhale, and the balloon tends to come out of their body. But it's actually a physiological reaction, because both the diaphragm and the pelvic floor are part of the core, and they work in coordination. This means that when we take a deep breath, the diaphragm creates space for the lungs and relaxes. So the pelvic floor relaxes as well. The balloon, and then the baby during the childbirth, tend to come out of the body. Whereas when we exhale, the diaphragm is activated, contracted, and returns to its original position to help with the exhalation of the air. That means the pelvic floor is activated, contracted, and the balloon tends to come back in. As I have already mentioned, using Aniball is limited by each woman's health condition. It is necessary to read all the contraindications and safety instructions before using it. Aniball is safe if you follow these instructions. It is always necessary to check the functionality and intactness of the balloon. Avoid using oil-based products. Do not inflate the balloon too much. Do not use it if it hurts, and respect your body. These are the main steps that prevent risks. Yes, definitely. Bleeding is a major contraindication when using Aniball. Bleeding can have a number of causes. One of them might be a close due date. The cervix is perfused, and a short-term spotting might appear after practicing. Pregnant women also suffer from vaginal yeast infections often, which cause greater blood circulation and fragility of the mucous membrane. Women may get injured during practicing, or a small vessel may rupture. It would probably burst during the childbirth anyway. If there is only spotting or mild bleeding, and it stops after practicing, we recommend you taking a break for 1 or 2 days and start practicing again after that. In the case of mycosis, it is necessary to treat it first and then start using the balloon. Women are often afraid to take a break from practicing, but it is not a race. A few days off will not do any harm. If you get injured as a result of not following the instructions, practice through pain and injure yourself due to using the balloon carelessly, we recommend you to stop practicing for at least 5 days and let the wound heal. Practicing with Aniball does not cause leakage of the amniotic fluid. Using Aniball does not cause premature birth. The mechanisms, induction, of childbirth are different. We do not recommend using Aniball in case of a yeast infection, mycosis, which women often suffer from during pregnancy. The vaginal mucosa is fragile, painful, red, and overly perfused. Using Aniball could cause injury. It mainly depends on the previous 2 childbirths. Aniball is supposed to help the woman get used to the feeling of pressure and teach her to consciously relax using proper breathing. Using Aniball might be useful even during a 3rd pregnancy, especially if the woman was injured during the previous childbirths. It is good to use Aniball in order to prevent possible scarring. It does not necessarily have to happen again during your next birth, but the injured tissue heals with a scar that behaves differently. It loses its elasticity, and therefore it is beneficial to practice with Aniball and work with the scar in prenatal preparation. Yes, we have good results with women who used Aniball during their 2nd pregnancy, and it paid off. We are proud to say that Aniball is made in the Czech Republic.